we are back again, guys. Fine. So we are starting the head and neck session. Okay. See, so whatever we are discussing all this time, okay, all are important things. Okay, most high yield areas, the questions which were asked several times. Okay, so we were discussing about that. Okay, so okay, yeah. So we are discussing about the important areas mainly of the upper lower limb and the abdomen, okay, and the pelvis perineum. Now we are moving into osteology of the head and neck. Again, I'm telling you, one of the most potential area to ask questions. Okay, so if you see this part, okay, the picture what they have shown is the view of the interior of the cranium. So this is nothing but the interior of the cranium. Okay, interior of the cranium. So this is nothing but the interior of the cranium, and this cranium is divided interiorly into three fossae. Okay, so the fossa what you see here is the anterior cranial fossa. This is called as anterior cranial fossa. Okay, the fossa what you see here is the middle cranial fossa. This is called as middle cranial fossa. This is called as middle cranial fossa. And the larger fossa, okay, which is seen on the posterior aspect, is called as a posterior cranial fossa. This is called as an posterior cranial fossa. This is called as posterior cranial fossa. Okay, so if you see these fosses, okay, and they have got certain bony landmarks to demarcate them. So the anterior cranial fossa is separated from the middle cranial fossa by means of this part of the sphenoid bone, which is called as the lesser wing of the sphenoid. This is called as the lesser wing of sphenoid, which divides or which separates the anterior cranial fossa from the middle cranial fossa, and the middle cranial fossa is separated from the posterior cranial fossa by means of this bone. Okay, this bone is the petrous temporal bone. This is the superior border. This is the superior border of petrous temporal bone. So this is the superior border of the petrous temporal bone, which separates the middle cranial fossa, from the posterior cranial fossa. Okay, it separates the middle cranial fossa from the posterior cranial fossa, and these entire fossas, okay, the anterior fossa is occupied by the frontal lobe. The middle fossa is occupied by the temporal lobe. Okay, so the anterior cranial fossa is occupied by the frontal lobe of the brain. The middle cranial fossa is occupied by the temporal lobe of the brain. Okay, temporal lobe of the brain. And the posterior cranial fossa is not occupied by the cerebrum, it is occupied by the cerebellum. It is occupied by the cerebellum. Okay, it is occupied by the cerebellum. Okay, so these are all the things which you come across in this. So they are preliminary demarcations, but what is most important is the foramens in the interior of the cranium. They put a mark in the foramens and they will ask you what is the structure that is passing through the foramen. Okay, so if you see the bones here, okay, so you see perforated bone here. This perforated bone is called as a cribriform plate. This is called as a cribriform plate, and this cribriform plate is a part of ethmoid bone. This is a part of ethmoid bone. Okay, and you see multiple perforations in it, and through the multiple perforations, okay, okay, lot of olfactory nerves. Okay, lot of olfactory nerves comes through this cribriform plate. Okay, so the structures passing through the cribriform plate is the olfactory nerves. Okay, just in front of the olfactory, just in front of the cribriform plate. Okay, you get a opening here. And this opening transmits, or this opening is called as foramen cecum. This opening is called as foramen cecum. Okay, this opening is called as foramen cecum. So we'll just see what is the structure that is passing through the foramen cecum. The structure which is passing through the foramen cecum is an emissary vein. From the nasal cavity. Emissary vein from the nasal cavity can pass through this foramen cecum, and it can open into the superior sagittal sinus, and it can open into the superior sagittal sinus. Okay, so if you see the cribriform plate, if you see the cribriform plate, on either side of the cribriform plate, on either side of the cribriform plate, okay, you see the frontal plate, okay, you see the frontal plate, and in between you see one big elevation here. What is this elevation? You see an elevation in the midline. The elevation what you see in the midline is called as crista galli. So what is this? This elevation what you see is called as an crista galli, okay, and this crista galli gives attachment for the anterior end of falx cerebri. I hope you know what is called as an falx cerebri. Falx cerebri, falx cerebelli, tentorium cerebelli, diaphragma cellae. Okay, so you got 4: falx cerebri, falx cerebelli, tentorium cerebelli, and diaphragma cellae, or the peritoneal or the reflections of the dura mater, or the reflections of the dura mater, and they divide the cranial cavity into various compartments. They divide the cranial cavity into various compartments. So one such dural fold, since I was talking about peritoneum, again and again peritoneum word is coming in my words. Okay, so when you talk about the dural folds, the main dural fold is falx cerebri, and the falx cerebri is attached to this bone which is called as crista galli, okay. And when you come just behind the cribriform plate, you see a foramen here. This foramen is called as posterior ethmoidal foramen. This foramen is called as an posterior ethmoidal foramen, which transmits the posterior ethmoidal nerve through it. Okay, and when you come slightly behind, okay, so you get an elevation here. This elevation what you see here is called as jugum sphenoidal. This is called as jugum sphenoidal. Okay, on either side of the jugum sphenoidal you have an opening. The opening which is present on either side of the jugum sphenoidal is called as an optic canal, and the structure which passes through the optic canal are: one is the optic nerve, another one is the ophthalmic artery. One is the optic nerve, another one is called as an ophthalmic artery. Okay, so very important very important area we are discussing. Okay, so you got jugum sphenoidal. On either side of the jugum sphenoidal we have an opening. So this opening is called as optic canal. Okay, optic canal is formed between the two processes of the sphenoid bone with the body of the sphenoid bone, and this optic canal transmits optic nerve and the ophthalmic artery. When you go more posterolaterally, okay, you get the middle cranial fossa. And if you see the middle cranial fossa, you see an opening here. Okay, the opening what you see here in the middle cranial fossa is nothing but the foramen rotundum. This is nothing but the foramen rotundum. So this is nothing but the foramen rotundum, and this foramen rotundum transmits an important nerve to the maxillary region, and that nerve is called as a maxillary nerve. So the nerve which passes through the foramen rotundum is nothing but the maxillary nerve. That is the second division of the trigeminal nerve. And when you go posterolateral to this foramen rotundum, you get the next opening. Okay, so this opening what you see here is called as the foramen ovale. This is called as foramen ovale. Okay, so through the foramen ovale you got 4 structures running through it. We can easily put a mnemonic for it, which is called as male. Okay, so the structure which carries the first letter, we put it as a mnemonic male. And if you see here, you can see the mandibular nerve passing through the foramen ovale, the accessory meningeal artery. Okay, accessory meningeal artery is passing through it, Okay, then you get the lesser petrosal nerve which is passing through this, and then you have the emissary veins passing through it. So we put it simply as male. So M stands for mandibular nerve. Okay, M stands for mandibular nerve. Okay, M stands for okay, M stands for okay. So M stands for mandibular nerve. Okay, I didn't saw the comments, guys. Sorry. So M stands for mandibular nerve. A stands for the accessory meningeal artery. L stands for the petrosal nerve. Okay, and the E stands for the emissary vein, and E stands for the emissary vein. So these are the four important structure that passes through the foramen ovale. Okay, so just behind the foramen ovale, okay, just behind the foramen ovale, you have another foramen. Okay, this foramen which is behind the foramen ovale, okay, is called as foramen spinosum. Is called as foramen spinosum. Is called as foramen spinosum. Okay, and the structure which is passing through the foramen spinosum are two. One is called as the middle meningeal artery. One is called as middle meningeal artery. One is called as middle meningeal artery. Very, very important structure. And next one is called as an nervus spinosus. Nervus spinosus. Nervus spinosus. Okay. So if you take these two foramens, one is foramen ovale, another one is foramen spinosum, they lie very close to each other. They lie very close to each other. Okay. So if you see here, one is the foramen spinosum. Okay. One is the foramen ovale, another one is the foramen spinosum. Okay. So you got an important structure running through the foramen ovale, that is mandibular nerve. What is this nerve? This is mandibular nerve. So this is mandibular nerve. This is mandibular nerve. From the mandibular nerve you get a branch. From the trunk of the mandibular nerve you get a branch. This branch is a branch which supplies the meninges. Okay, this branch is a branch which supplies the meninges or the dura mater. This branch which is coming from the mandibular nerve passing through the foramen spinosum is called as nervus spinosus. It is called as nervus spinosum. It is called as nervus spinosum. It is called as what? It is called as nervus spinosum. So mandibular nerve is passing through the foramen ovale. So from the mandibular nerve there is a branch which comes and enters into the foramen spinosum, and that nerve is called as nervus spinosus. That nerve is called as nervus spinosus. Okay, the main content of the foramen spinosum is this artery. This artery you all know, this is called as the middle meningeal artery. This is called as what? Middle meningeal artery. This is called as middle meningeal artery, and this middle meningeal artery, before it enters the foramen spinosum, it gives a branch, and this branch enters into the foramen ovale. This branch enters into the foramen ovale. So this branch which is entering into the foramen ovale is nothing but the accessory meningeal artery. Is nothing but the accessory meningeal artery. Is nothing but the accessory meningeal artery. If somebody asks you, accessory meningeal artery is a branch of what? It is a branch of middle meningeal artery. And nervus spinosus is a branch of what? Nervus spinosus is a branch of mandibular nerve. Nervus spinosus is a branch of mandibular nerve. Okay, nerve of it's called as mandibular nerve. Okay, so now you get another foramen here. Okay, you get another foramen here, just medial to the foramen ovale. This foramen is formed at the junction of three bones: occipital bone, sphenoid bone, and the temporal bone. Okay, so you can see the pink color bone, which is the temporal bone, petrous part of the temporal bone. Yellow color bone, that is the shaded area, yellow shaded area, there is the sphenoid bone. And just behind the sphenoid bone you got the basilar part of the occipital bone. So these three bones join at one area where you get a foramen, and this foramen is called as what? This foramen is called as foramen lacerum. Okay, so this is torn. So the usually if you take a foramen, the foramen will be perfect, a round like structure, but this foramen is not it is shattered here and there. The margins are not clear. So it is like a lacerated wound, that is why it is called as an foramen lacerum. It is called as foramen lacerum. It is called as foramen lacerum. And if you ask any structure, if you ask me whether there is any structure that passes through the foramen lacerum from below or from above downwards, no. So no structure passes like that. Okay, below the foramen lacerum is closed by a fibrocartilaginous tissue. So it is closed from below by a fibrocartilage. Okay, it is closed from below by a fibrocartilage. Okay, but there are a lot of other stories around the foramen lacerum. We will discuss that in a short while when we come to the next pages. Okay, so as of now, nothing comes from below through the foramen lacerum, because the foramen lacerum below is closed by a cartilage, which is a fibrocartilage, which is a fibrocartilage there. Okay, which is a fibrocartilage there. Okay, so these are all the important foramens in the middle cranial fossa. We haven't discussed one more foramen that I will show it in another picture, that is the superior orbital fissure. Okay, so I haven't touched that here, but as of now, these are the important foramens in the middle cranial fossa. Okay, now when you jump over the petrous temporal bone, okay, when you jump over the petrous temporal bone, you land into the posterior cranial fossa. You land into the posterior cranial fossa, and when you come to the posterior cranial fossa, okay, you see a big foramen here. This foramen is called as the foramen magnum. So this is the largest foramen. So that is why it is called as an foramen magnum. That is why it is called as an foramen magnum. And if you see the foramen magnum, we divide the foramen magnum into two halves, two unequal halves. Okay, so you can divide the foramen magnum into two unequal halves. The anterior part is occupied by ligaments and bones. Okay, the anterior part is occupied by ligament and bones, and the posterior part is occupied by nervous tissue. The posterior part is occupied by nervous tissue. Okay, so if you take the foramen magnum, the anterior portion is completely occupied by ligaments and bones, whereas the posterior part is occupied by the nervous tissue and the vessels. Okay, so if you take the foramen magnum, these are all the structures which are passing through the foramen magnum. Okay, so these are all the structures which are passing through the foramen magnum. Okay, so if you see the foramen magnum, you can see the anterior part. It is not the arterial part, it is anterior part. Okay, it is the anterior part. In the anterior part, you can see the apical ligament of dens. Okay, apical ligament of dens. Can anybody tell me apical ligament of dens is a remnant of what? Can anybody tell me apical ligament is a remnant of what? Apical ligament of dens is a remnant of what? Anybody, guys? You guys are rocking last 2.5 days. So you guys are really rocking. Now if you answer this question, I will be very, very happy. Okay, so what is this apical ligament of dens? Apical ligament of dens, okay, the remnant is normally when you take the remnant here, so the notochord is a structure which forms the apical ligament of dens. So notochord remnant is apical ligament of dens. Membrana tectoria is also a remnant of notochord. Membrana tectoria is also a remnant of notochord. Okay, is also a remnant of notochord. So these two structures here are a remnant of notochord. Notochord is a primitive structure in the embryo which induces the formation of neural tube. Okay, what is notochord? Okay, what is notochord? Notochord is a structure. Okay, notochord is a structure which induces the formation of neural tube, which induces the formation of neural tube. Okay, which induces the formation of neural tube. And once after the neural tube is formed, once the vertebra develops, this notochord becomes remnant. This notochord remnant is seen in various parts of our body. One such area is apical ligament of dens. The next one is called as membrana tectoria. Okay, membrana tectoria is a continuation of posterior atlanto-occipital membrane. So there is a membrane called as posterior atlanto-occipital membrane. Okay, so this membrane, or what you say, this is the posterior longitudinal ligament. We can put it like this. So membrana tectoria is a continuation of posterior longitudinal ligament. So membrana tectoria is a continuation of posterior longitudinal ligament. Okay, membrana tectoria is a continuation of posterior longitudinal ligament. And what is this? They are remnants of notochord. They are all remnants of notochord. Can anybody tell me one more remnant of notochord? Guys, very important area, high yield area. Lot of times these questions have come. If you have gone through the previous year question papers, 100% remnant of notochord they would have asked in the exams. So one is apical ligament of dens, next is the membrana tectoria, and one more remnant of notochord is the nucleus pulposus. Okay, and can anybody tell me where is nucleus pulposus seen? Yes guys, where is nucleus pulposus seen? Where is nucleus pulposus seen? Anybody? In which part of our body nucleus pulposus is seen? Yes guys, it has got an important pathology related to it. Where you get nucleus pulposus? Yes guys, nucleus pulposus is seen in the intervertebral disc area. Okay, so in the intervertebral disc, okay, if you take the intervertebral disc, so the intervertebral disc has got the following parts. Okay, so the intervertebral disc has got the following parts. The outer part of the intervertebral disc, okay, so the outer part of the intervertebral disc is called as annulus fibrosus. This is called as annulus fibrosus. Inside the annulus fibrosus you get a jelly like structure. Okay, this jelly like structure which is present inside the annulus fibrosus is called as nucleus pulposus. So this is called as nucleus pulposus. Okay, this nucleus pulposus is the one which is responsible for nerve irritation in an intervertebral disc prolapse. Okay, when an intervertebral disc prolapse happens, it is this nucleus pulposus which comes out and irritates the nerve. It is highly chemogenic. Okay, so it irritates the nerve and it causes severe pain. Okay, so this is nucleus pulposus seen in the intervertebral disc, which is a remnant of notochord. Okay, so yes, come back to our topic, foramen magnum. So foramen magnum in the anterior part, it contains the apical ligament of dens, it contains membrana tectoria, and it also contains the vertical bands of the cruciate ligaments. All these ligaments are part of atlantoaxial joint. All these ligaments are part of atlantoaxial joint. Okay, so in the foramen magnum in the anterior part, okay, you have the you have these ligaments. Okay, they are all part of the atlantoaxial joint. Okay, now when you go to the posterior part, it is predominantly neurovascular structures. You can see the spinal artery there, you can see the vertebral artery, you can see the lower part of the medulla. Okay, you can see the lower part of the medulla, and you can also see the spinal part of the accessory nerve. There. Okay, so in the posterior part, it is predominantly neurovascular structures. Always remember guys, the structure which comes out of the foramen magnum is not the spinal cord, it is the lower part of the medulla. You all know that medulla continues down into the vertebral canal. Okay, and this medulla crosses the foramen magnum, then becomes the spinal cord. Okay, it is not above the foramen magnum, it is below the foramen magnum. Okay, so these are all the important structures which are running through the foramen magnum. Okay, so we'll just come back to the next foramen in the posterior cranial fossa. So the next foramen in the posterior cranial fossa, which is lying just on the posterior aspect of the petrous temporal bone, is this foramen. Okay, so the foramen what you see here, okay, this foramen is called as the internal aquestic meatus. This is called as an internal aquestic meatus. Okay, this internal aquestic meatus transmits two important nerves. One is the 7th cranial nerve. Okay, and next one is the 8th cranial nerve. Okay, along with that, it also transmits an artery called as labyrinthine artery. Okay, it also transmits an artery called as labyrinthine artery. But when you study this internal acoustic meatus in detail, okay, if you study this internal acoustic meatus in detail, okay, this internal acoustic meatus will have an horizontal bar of bone separating it into two halves. This horizontal bar of bone, what you see here, is called as an falciform crest. Is called as an falciform crest. Is called as an falciform crest from the roof of the internal auditory meatus. Okay, there is a vertical bar of bone which comes here, and this bar of bone is called as a Bill's bar. So this is called as an Bill's bar. Okay, this is called as an Bill's bar, which is seen in this area. So this is the vertical bar of bone which is seen in the internal auditory meatus. Okay, so that is called as Bill's bar. Okay, now when you take this entire foramen, now the entire foramen is divided into 4 areas. Okay, the entire foramen is divided into 4 areas. So in one quadrant the facial nerve runs. So the facial nerve has got 2 parts in it. This is called as the motor part of the facial nerve, and the sensory part of the facial nerve which is running here is called as nervus intermedius. It is called as nervus intermedius. Okay, they run in this quadrant. Just behind that you have the superior vestibular area. Okay, so superior vestibular area, the vestibular nerve from the superior vestibular area runs through this, and the vestibular nerve from the lower or the inferior vestibular area runs through this quadrant, and here runs a cochlear nerve, and here runs the cochlear nerve. Okay, so these are the important nerves which runs in this. I think don't worry about much about this area, just have an clear cut understanding that 3 structures runs through it. One is 3 structure runs through it. Thank you. So 3 structure runs through it. One is called as the 7th cranial nerve. One is called as the 7th cranial nerve. The next one is called as an the 8th cranial nerve, that is the vestibulocochlear nerve, and the labyrinthine artery which runs through this. Okay, labyrinthine artery which runs through this. Okay, so this is about the structures which are running through the internal acoustic meatus. Okay, so when you just see below the internal acoustic meatus, at the junction of the petrous temporal bone and the occiput bone, you also have an important foramen. Okay, so the foramen what you see here, okay, this foramen what you see here is called as an jugular foramen. This is called as an jugular foramen. Okay, so very important foramen. Lot of important nerves runs in this. Okay, so jugular foramen is divided into 3 parts, guys. If you take the jugular foramen, okay, so if you take the jugular foramen, let us consider this is jugular foramen. Okay, I divide the jugular foramen into 3 parts. Okay, so the anterior part, the middle part, and the posterior part. Okay, so you divide the jugular foramen into 3 parts. One is called as an anterior part, the middle part, and the posterior part. And the structure which runs through the anterior part is an sinus which is called as an inferior petrosal sinus. So this sinus which is passing through the anterior part is called as an inferior petrosal sinus. This is inferior petrosal sinus. And what is this foramen? This is called as an jugular foramen. We divide the jugular foramen into 3 parts: anterior part, middle part, and into the posterior part. Okay, so whenever there is an vein present on the anterior most part of the jugular foramen, it is inferior petrosal vein. Okay, it is inferior petrosal vein, and just behind this you have 3 nerves which are running, 3 important nerves of the pharyngeal region. Okay, so those are the 9th, 10th, and the 11th cranial nerves. So the 9th, 10th, and the 11th cranial nerve. So what is the 9th nerve? The 9th nerve is the glossopharyngeal nerve. The The 10th nerve is the vagus nerve. 10th nerve is the vagus nerve, and the 11th nerve is the accessory nerve. The 11th nerve is the accessory nerve. Okay, so these are the nerves which passes through the middle part of the jugular foramen. Okay, so these are the nerves that passes through the middle portion of the jugular foramen. When you go posterior to this area, the posteriormost part of the jugular foramen is occupied by a sinus, and this sinus is nothing but the sigmoid sinus. Okay, so sigmoid sinus continues as the internal jugular vein. So it is the sigmoid sinus which passes through this and becomes the internal jugular vein So these are all the important structures which are passing through the jugular foramen. So if there is any tumor in this area, okay, they can compress these structures and it can cause lot of manifestations in the face. Okay, so if such a tumor occurs, in the jugular foramen, okay, it can compress, the structures there. So there is a common tumor which is called as a glomus tumor, okay, which can compress the structures in the jugular foramen, and when it compresses the structure in the jugular foramen, the nerves traversing the jugular foramen are affected. So you know that there are three nerves which traverses here, that is the glossopharyngeal, vagus, and the accessory nerve. So when the glossopharyngeal nerve is affected, there will be loss of taste sensation. Okay, there will be loss of taste sensation, okay, in the tongue. In which part of the tongue? In the posterior 1/3 of the tongue. We have discussed again in the previous talks, the anterior 2/3 of the tongue, general sensation and taste sensation is carried by the lingual nerve. Taste sensation is by chorda tympani through the lingual nerve from the anterior 2/3. From the posterior 1/3 of the tongue, the taste sensations are carried by the glossopharyngeal nerve. So in Wernicke syndrome, where there is a glomus jugulare tumor compressing over the jugular foramen, so you have this problem where you have loss of taste sensation. The patient will also have vocal paralysis and anesthesia of the larynx and pharynx, because those areas are supplied by the 10th cranial nerve. We will see in detail about these areas tomorrow. Okay, and the 11th cranial nerve supplies the sternocleidomastoid and the trapezius muscle. So when these muscle becomes weak, okay, so when these muscles becomes weak, when sternocleidomastoid muscle becomes weak, you will have difficulty in turning your head, and when the trapezius muscle becomes weak, you will have difficulty in shrugging your shoulder. So all these symptoms can occur in jugular foramen syndrome. Okay, so this is what we have seen here. So this is about the jugular foramen. Okay, and the structures passing through the jugular foramen. Okay, so when you go a little bit inferiorly, in the posterior cranial fossa, you also see one more canal. Okay, the last canal what we are going to discuss in this view is this one. This canal is called as an hypoglossal canal. So this canal, which is called as an hypoglossal canal, okay, transmits, this hypoglossal canal transmits the hypoglossal nerve through it. Okay, so it transmits the 12th cranial nerve through it. 12th cranial nerve, which is called as an hypoglossal nerve, runs through this hypoglossal canal, Okay, so these are the important structures which pass through the various foramens. When you look in this view, the one foramen what I told we will discuss later is the foramen lacerum. So if you see the foramen lacerum here, okay, as I already told, the inferior aspect of the foramen lacerum is covered by an fibrocartilage. So no structure passes from below through the foramen lacerum. But what is happening here is there is a canal called as carotid canal. Okay, there is a canal called as carotid canal. So this is the carotid canal. If you see the carotid canal, the anterior end of the carotid canal opens into the foramen lacerum. So this carotid canal allows the passage of internal carotid artery. So this internal carotid artery passes through the carotid canal, then traverses the foramen lacerum and reaches the cranial cavity. So foramen lacerum does not allows any structure through it, but it is the carotid canal which is allowing the internal carotid artery. Since it opens into the foramen lacerum, a small part of the foramen lacerum carries the carotid artery along with it. Okay, so this is what you have to understand from this picture. Okay, and more important is, so if you see foramen lacerum, okay, if you see the, let us consider this is foramen lacerum. Okay, so one canal is opening on its posterior wall and there is another canal which is opening on its anterior wall. Okay, so what is the canal which is opening on the posterior wall? This canal is called as a carotid canal. This is called as a carotid canal, and the canal which opens on the anterior wall is called as a pterygoid canal. So this is called as a pterygoid canal. So this pterygoid canal runs from the anterior part of the foramen lacerum and it opens into the spinopalatine foramen. Okay, it opens into the pterygopalatine fossa. Yes, it opens into the pterygopalatine fossa. We will discuss about that, but just to have an understanding. Okay, so the pterygoid canal is related to the anterior wall of the foramen lacerum, and to the posterior wall of the foramen lacerum, carotid canal is related to it. Okay, so these are all the important take home things from this okay, teaching. So we'll go to the next view of the skull, that is the inferior view of the skull. So this is the inferior view of the skull. Okay, so when you see the inferior view of the skull, again you get a lot of important regions in this. Okay, so this is the normobasalis view of the skull. And when you see this, you see the hard palate here. Okay, you see the alveolar arches here. So this is called as the alveolar arches. And just behind the alveolar arch you get a canal. This canal is called as an incisive canal. Okay, this incisive canal transmits the branches of nasopalatine nerves. Okay, transmit the branches of nasopalatine nerves. So the incisive canal transmit the branches of nasopalatine nerves. Okay, so when you just go behind the incisive foramen, you see this palate. This is called as an hard palate. Okay, this hard palate is formed by two bones. Okay, so this bone is the maxilla. Okay, this bone is the maxilla, and this bone is the palatine bone. Okay, so two bones. So the horizontal plate of maxilla and the horizontal plate of palatine bone forms a hard palate, and they are connected by this suture which is called as a cruciform suture. So this suture is called as a cruciform suture. Nothing important about it, just understand that there is a cruciform suture here. Okay, if you understand that, that is more than enough. Okay, so when you go just behind the cruciform suture, you see a foramen here. This foramen is called as a greater palatine foramen. This is called as a greater palatine foramen. Which transmits the greater palatine nerves and vessels. Which transmits the greater palatine nerves and the vessels. And just behind the greater palatine foramen, okay, you have the lesser palatine foramen. This is called as a lesser palatine foramen. Which transmits the lesser palatine nerves and vessels. Okay, so these are all the structures which passes here. Okay, these are all the structures which passes here. And when you go posterior to this hard palate, you get this aperture. This is called as the posterior nasal aperture. Or posterior choana. This is called as the posterior nasal aperture, and this posterior nasal apertures are divided in the midline by a bone. What you see here is called as the Omer bone. So the bone what you see here is the Omer bone. Okay, this is called as Omer bone, and this Omer bone connects with the rostrum of the sphenoid. It connects with the rostrum of the sphenoid. Okay, it connects with the rostrum of the sphenoid. Okay, so this is about the Omer bone and the rostrum of the sphenoid here. When you go lateral to the Omer bone, you see this plate which are hanging from above. These plates are called as the medial and the lateral pterygoid plates. These are called as the medial and the lateral pterygoid plates. These are called as the medial and the lateral pterygoid plates. Okay, so they are called as the medial and the lateral pterygoid plates. If you trace the medial pterygoid plate, okay, when you trace it above, it divides into two and forms or encloses a fossa. This fossa is called as a scaphoid fossa. This fossa is called as a scaphoid fossa, and this scaphoid fossa gives origin for a muscle called as tensor veli palatini. It gives an origin for a muscle called as tensor veli palatini. Tensor veli palatini is a muscle of the soft palate. Okay, it's a muscle of the soft palate. Okay, so this tensor veli palatini arises from this fossa which is called as a scaphoid fossa, which is called as a scaphoid fossa here. Okay, which is called as a scaphoid fossa here. Okay, when you go just behind the pterygoid region, okay, when you go just behind the pterygoid region, you get the basilar part of the occiput bone. So this is called as the basilar part of the occiput bone. This is the basilar part of the occiput bone. Okay, this is the basilar part of the occiput bone. Okay, and in between the basilar part of the occiput bone and in between the petrous part of the temporal bone and between the sphenoid, you get this foramen. This foramen is a foramen which is covered by fibrocartilage. You are seeing it from the other view. This is nothing but the foramen lacerum. This is nothing but the foramen lacerum. We have talked about the foramen lacerum, so don't worry about it. What is important in this view and what you want to appreciate in this view, which was not seen in the interior view of the skull, is the opening which is leading to the foramen lacerum, that is this canal. That is this canal. Okay, this canal what you see here. Okay, this canal what you see here. This canal what you see here is the carotid canal. So what is this canal? So this canal what you see here is the carotid canal. So this is called as carotid canal. This is called as carotid canal. Okay, so this canal is called as carotid canal. Okay, so this is called as carotid canal. So you should know about this carotid canal, which is important. This carotid canal transmits the internal carotid artery. This transmits the internal carotid artery. Okay, so this transmits the internal carotid artery through it. Okay, so when you trace the canal slightly behind, you have a projection here. You have a projection here. You can see the projection here. This bony projection what you see here is called as the styloid process. Is called as a styloid process. Is called as a styloid process, and this styloid process is separated by a small groove from this bony process, which is called as a mastoid process, which is called as a mastoid process. And between the styloid process and the mastoid process, you get a foramen. This foramen is called as stylomastoid foramen. This is called as stylomastoid foramen, and this stylomastoid foramen allows the exit of the seventh nerve. So seventh nerve, it enters through the internal acoustic meatus. So the seventh nerve enters through the internal aquatic meatus. Seventh nerve is nothing but the facial nerve. It enters through the internal acoustic meatus. It has a course around the internal ear and the middle ear, which are present within the petrous temporal bone, and it exits out of the skull through this foramen, which is stylomastoid foramen. So the stylomastoid foramen allows the exit of the seventh nerve. It also allows an artery passing through it, which is called as a stylomastoid artery. This is called as a stylomastoid artery. So these are the two structures which passes through the stylomastoid foramen, Okay, so here you can see this foramen which we have discussed already. So this foramen what you see here is called as a jugular foramen. What you see here is called as an jugular foramen. What you see here is called as a jugular foramen, and the foramen magnum which stands in front of you, we have discussed about the foramen magnum also. Now you get a fossa here. Okay, you get a fossa here. This fossa is called as an mandibular fossa, which articulates with the condylar process of the mandible to form a joint called as TM joint. So temporomandibular joint is formed in this area. Temporomandibular joint is formed in this area. Okay, and this arch what you see here is nothing but the zygomatic arch. It is nothing but the zygomatic arch. It is nothing but the zygomatic arch. Okay, so these are all the important things to be noted when you look from the inferior aspect. Two important canals, don't forget, in the inferior view. One is the carotid canal opening which transmits the internal carotid artery. Behind that you have got the stylomastoid foramen. Okay, and through the stylomastoid foramen runs the seventh cranial nerve and the stylomastoid artery. Okay, so this is about the inferior view of the skull. Now to discuss one more important fissure which we haven't discussed, I think we have got this bone here. So this bone is a very peculiar bone. It has got a bat wing like appearance. It has got a bat wing like appearance. Okay, so this bone what you see here is called as the sphenoid bone. It's called as a sphenoid bone. So if you see the sphenoid bone, okay, this part of the sphenoid bone is called as body of sphenoid. This is called as body of sphenoid. The portion what you see here is called as a lesser wing of sphenoid. It's called as a lesser wing of sphenoid. The portion what you see here is called as a greater wing of sphenoid. This is called as a greater wing of sphenoid. In between the superior, in between the lesser wing and in between the greater wing, you get a fissure. This fissure is called as a superior orbital fissure. This fissure is called as an superior orbital fissure. This fissure is called as an superior orbital fissure. Okay, so this fissure is called as an superior orbital fissure. Okay, so this superior orbital fissure transmits a lot of structures. We'll discuss about that in a short while now. Okay, so the superior orbital fissure transmits a lot of structure. Now what you see here is the two process of the lesser wing. So the two process of the lesser wing encloses a canal. This is called as optic canal. This is called as an optic canal. This is called as an optic canal. Okay, so you see a sinus below the body, and this sinus what you see below the body or within the body of the sphenoid is called as a sphenoidal sinus. Is called as a sphenoidal sinus. It is called as a sphenoidal sinus. Okay, so when you see the anterior aspect of the sphenoid, you can see this foramen. This foramen is called as a foramen rotundum. This is called as foramen rotundum. Okay, and can anybody tell me what is the structure that passes through the foramen rotundum? We discussed about that structure. Okay, when we discussed about the middle cranial fossa, we discussed about that structure. What is that structure which passes through the foramen rotundum? Guys, yes, the structure which passes through the foramen rotundum. Guys, yes, we discussed about the foramen rotundum. Okay, so what is the structure that passes through the foramen rotundum called as? Yes, it is maxillary nerve. Very good, guys, it is maxillary nerve. Okay, so we discuss about it. So the structure which passes through the foramen rotundum is maxillary nerve. So that is the fifth cranial nerve. That is the second part of the fifth cranial nerve. Now if you see below the foramen rotundum, you have this canal. This canal is called as the pterygoid canal. This canal is called as a pterygoid canal. Okay, so this pterygoid canal transmits the passage of nerve of pterygoid canal. Transmits the passage of nerve of pterygoid canal. Okay, how this nerve of pterygoid canal is formed? The nerve of pterygoid canal is formed by two nerves. One is called as a greater petrosal nerve. One is called as a greater petrosal nerve. Another one is called as a deep petrosal nerve. One is called as a greater petrosal nerve. Another one is called as a deep petrosal nerve. What is this greater petrosal nerve? Greater petrosal nerve is a parasympathetic branch. Okay, it is an parasympathetic branch. It is a sympathetic branch from the facial nerve. It is a parasympathetic branch from the facial nerve. It is a parasympathetic branch from the facial nerve, okay, that ultimately supplies the lacrimal gland. That ultimately supplies the lacrimal gland, okay, that ultimately supplies the lacrimal gland. Deep petrosal nerve is a sympathetic plexus. It is formed by a sympathetic plexus around the, it is formed by a sympathetic plexus around the, okay, it is formed by a sympathetic plexus around the, okay, internal carotid artery. So deep petrosal nerve, you get a sympathetic plexus around the internal carotid artery, so that gives rise to deep petrosal nerve. And the other branch, it's a parasympathetic branch which arises from the facial nerve, is the greater petrosal nerve. These two nerves join to form the nerve of pterygoid canal, join to form the nerve of pterygoid canal. So the nerve of pterygoid canal passes through this canal which is called as pterygoid canal, which is called as pterygoid canal. And this nerve of pterygoid canal, this nerve of pterygoid canal is also called as, yes guys, nerve of pterygoid canal is also called as what? It is also called as, anybody? Nerve of pterygoid canal, yes guys, very good Hari, very good Muga. It is also called as Vidian nerve. It is also called as Vidian nerve. It is also called as an Vidian nerve. Very good, excellent. So it is also called as an Vidian nerve, okay. So that is what they are telling here. Vidian nerve passes through and Vidian nerve is formed by, okay. So we know how Vidian nerve is formed and we know how Vidian nerve passes through. It passes through the pterygoid canal. It passes through the pterygoid canal. It is formed by the fusion of greater petrosal and the deep petrosal nerve, and by the deep petrosal nerve, okay. So with this we are moving to the next next bone in the face, which is the largest facial bone, okay. So mandible is the largest facial bone, okay. This is the largest facial bone, okay. It is the largest facial bone. It has got lot of parts in it, okay. It has got lot of parts in it, and that parts gives lot of attachment to lot of structures. So what you see here is the condyle of the mandible. This is called as a condyle of the mandible, okay. This condyle of the mandible forms the TM joint, okay. This condyle of the mandible forms the TM joint or the temporomandibular joint, okay. It is a saddle type of joint. It is a saddle type of joint, and it is also a complex joint. Why it is called as a complex joint? Okay, it has got an articular disc with it. It has got an articular disc with it. Okay, it has got an articular disc with it. Okay, so you got an articular disc here. Okay, so the mandible head is also called as the condyle of the mandible. It is also called as a condyle of the mandible. And this condyle of the mandible articulates with the mandibular fossa of the temporal bone. It articulates with the mandibular fossa of the temporal bone to form a joint called as temporomandibular joint. That is why it is called as a temporomandibular joint. It's a saddle joint. It is a complex joint because there is a disc which is present inside the joint, that is called as an articular disc. That is called as an articular disc, okay. And one important muscle gets attached to this condyle of the mandible, and the muscle which is attached to the condyle of the mandible in this area is the lateral pterygoid muscle. Is the lateral pterygoid muscle. Is the lateral pterygoid muscle. Okay, so the muscle which is attached here is the lateral pterygoid muscle. Okay, yes. So if you see the jaw bones, okay, lateral pterygoid muscle. If you see the bones, okay, the maxilla is above and the mandible is below. Maxilla is a fixed bone, mandible is a bone which is moving. So if you want to grind, if you want to speak, this muscle, this bone has to move. Okay, so the muscles which helps in chewing or the muscle which helps in mastication are called the muscles of mastications, and all these muscles gets inserted into the mandible. All this muscle gets inserted into the mandible, thereby they move the mandible in various ways. Okay, so those muscles are called as muscles of mastication. Okay, those muscles are called as muscles of mastication. Now if you see on the anterior portion, you see a process which is spiking here. Okay, so this process what you see here is called as the, okay, coronoid process. It is called as a coronoid. Just a second, guys. It is called as a coronoid process of the mandible. It is called as a coronoid process of the mandible. Okay, and this coronoid process of the mandible gives attachment for a muscle here. So the muscle which is attached to this coronoid process of the mandible is called as the temporalis muscle. What is this muscle? This muscle, what you see here, is the temporalis muscle. This is called as temporalis muscle. Okay, on the inner side of the ramus of the mandible. So what is ramus of the mandible? This portion is called as the ramus of the mandible. This is called as the ramus of the mandible. Okay, on the inner portion of the ramus of the mandible, you see a foramen which is marked as A here. This foramen, what you see here, is called as a mandibular foramen. Now what is this foramen, guys? Okay, so this foramen is called as mandibular foramen. This is called as mandibular foramen, and this mandibular foramen allows the passage of inferior alveolar nerves and vessels. It allows the passage of inferior alveolar nerves and vessels. Okay, so what is the nerve which runs here? So the nerve which runs is the inferior alveolar nerve. The vessel which runs here is the inferior alveolar vessel. And you get a small projection here which is called as the lingula of the mandible. It is called as a lingula of the mandible, okay, or a spine of the mandible. And there is a ligament which is attached here which is called as a spinomandibular ligament. Okay, what is the ligament which is attached in this area? The ligament which is attached in this area is called as an spinomandibular ligament. So the ligament which is attached here is called as an spinomandibular ligament. So this is called as an spinomandibular ligament. Okay, spinomandibular ligament. Okay, so now there is a branch from the inferior alveolar nerve. So you see a ligament here. So there is a branch from the inferior alveolar nerve which pierces this spinomandibular ligament and comes to the myloid region. Okay, so the nerve which pierces the spinomandibular ligament is nothing but the mylohyoid nerve. So that is nothing but the mylohyoid nerve. Okay, so you get a spine like projection which is called as the lingula of the mandible or the spine of the mandible. So there is a ligament which is attached to that area. That ligament is closing the inferior alveolar foramen. It is hiding the inferior alveolar foramen, but a structure is piercing it and coming out. That structure is the mylohyoid nerve, which is a branch of the inferior alveolar nerve, And if you see here, you see a faint line here. Okay, you see a faint line here, and this line is called as the mylohyoid line, which gives attachment for the mylohyoid muscle. So it gives attachment for the mylohyoid muscle. Okay, and the ramus on its inner surface. Okay, in this area, it gives attachment for another pterygoid muscle which is called as the medial pterygoid muscle. So medial pterygoid muscle is attached. So medial pterygoid muscle is attached to this area. It is getting inserted into this area. Okay, so now there is a small fossa which is present below the mylohyoid line, which lodges structure here. So the structure which is lodged in this area is the superficial part of the submandibular gland. It is the superficial part of the submandibular gland. So below the mylohyoid muscle. Okay, so what you see here is the superficial part of the submandibular gland. It is the superficial part of the submandibular gland. Okay, the superficial part of submandibular gland is what you see here. Okay, and deep part of the submandibular gland is situated above the mylohyoid muscle. One portion is lying below the mylohyoid, that is the superficial part of the submandibular gland. The other is lying above the mylohyoid, that is the deep part of the submandibular gland. Now when you come to the anterior aspect, just behind the anterior aspect of the mandible. Okay, the body, just behind the anterior aspect of the body, you see a tubercle here. Okay, you see a tubercle here. The tubercles what you see here are called as the genial tubercles. Okay, I'll call as a genial tubercles. Okay, you got a genial tubercle above, superior genial tubercle, and then inferior genial tubercle. Okay, so what are these? These are called as the genial tubercles. These are called as the genial tubercles, and this genial tubercles gives attachment. This genial tubercles gives attachment for the genioglossus muscle, and the geniohyoid muscle. It gives attachment for genioglossus and geniohyoid muscle. Okay, so lot of things, guys. Still more, if you talk, we can talk half an hour about mandible. Okay, so lot of things are there. So just I want to highlight the important things in this area. So we have seen about the important areas around the mandible here. Okay, so with this we'll move to the next part of the Edenex. So this picture has come several times in the exam. We have seen the foramens. Here it is again the cranial fossa. It is the interior of the cranial fossa, but here you can see a shining layer, that is dura mater. And you can see various nerves passing through it. So now I am going to put the arrow marks in these nerves, and you guys are going to answer. This is a test session like thing. So what is this structure? Which is seen in this area? Okay, yes, what is the structure which is seen in this area? Anybody? It is internal carotid artery. It is not optic nerve, guys. Okay, so please remember, it is not optic nerve. Okay, you can see a lumen in this. Okay, so what happens is the internal carotid artery, after passing through the cavernous sinus, it forms a carotid siphon and turns back. Okay, it comes into the cranial cavity. So it is passing through the foramen lacerum, turns upwards, forms a carotid siphon and turns backwards and enters the cranial cavity. So that is the opening what you are seeing. Monisha, very good. Soumya, it is very good. It is internal carotid artery. Just behind the internal carotid artery, guys, you see a nerve which is cut here. The cut portion of the nerve, what you see here, is the optic nerve. This is optic nerve. So this is optic nerve, and this is internal carotid. You see the lumen, guys, you cannot go wrong. It is internal carotid artery. Okay, so internal carotid artery is passing through a sinus. That sinus is called as cavernous sinus. What is this sinus? This sinus is called as cavernous sinus. This sinus is called as cavernous sinus. I hope you would have seen this diagram in your UG days. So this will be the pituitary fossa. This is the sphenoid bone. This is the pituitary fossa. On the side you have the cavernous sinus here. And running along the walls of the cavernous sinus. Okay, you have nerves running along the walls of the cavernous sinus. You have the nerves which are running along the walls of the cavernous sinus. Okay, isn't it or not? So you can see the nerves which are running along the walls of the cavernous sinus, and within the cavernous sinus runs one structure, and just above it runs another structure. So you might have known all these pictures. Okay, so these are all the structures which runs on the lateral wall of cavernous sinus. So what you see here on the lateral wall of cavernous sinus, the first nerve is the third cranial nerve, the next nerve is the fourth cranial nerve. This is the ophthalmic division of the trigeminal nerve, and this is the maxillary division of the trigeminal nerve. And running within the cavernous sinus is the sixth cranial nerve. This picture again we'll discuss tomorrow when we talk about the cavernous sinus. Okay, as of now, just have an idea that this area what we have marked as cavernous sinus. So when you see on the lateral wall of cavernous sinus, if you see a nerve, this will be the oculomotor nerve. This is the first nerve you see on the lateral wall of cavernous sinus in a superior part. in its superior part. Okay, and when you see here slightly to the lateral portion of the slightly to the when you see just slightly to the lateral portion of the oculomotor nerve, you see the next nerve here, this is called as a trochlea nerve, this is called as a trochlea nerve. Okay, and this nerve which is entering through the apex of the petrous part of the temporal bone. Okay, this nerve is called as a trigeminal nerve, this is called as a trigeminal nerve, this is called as a trigeminal nerve. Okay, below the trigeminal nerve you can see a nerve which is passing below the petrosphenoid ligament. This ligament or this nerve is called as an abducent nerve. So what is this nerve? This is called as an abducent nerve. Okay, so this is the one which passes through the or passes close to the apex of the petrous temporal bone, passes close to the apex of the petrous temporal bone. So petrositis or inflammation of the petrous temporal bone can affect abducent nerve easily. It can affect the abducent nerve easily. Okay, it can affect the abducent nerve easily. Now on the posterior surface of the petrous temporal bone you have this canal. Okay, this is called as the internal acoustic meatus, this is called as an internal acoustic meatus, which allows the transmission of 7th and the 8th cranial nerve, the facial and the vestibulocochlear nerve. Below this you have this foramen which is allowing the passage of 9th, 10th and the 11th cranial nerve. So these three nerves, okay, so the glossopharyngeal, vagus and the accessory nerves and the spinal accessory nerves, they pass through this foramen. Okay, they pass through this foramen. This is the jugular foramen what we are seeing there. Okay, and below that you have the hypoglossal canal. This is the last canal, it's a hypoglossal canal which is transmitting the hypoglossal nerve. Okay, which is transmitting the hypoglossal nerve. 12th cranial nerve, which is the hypoglossal nerve, passes through the hypoglossal canal. So this is a cadaveric image, a little bit tricky image unless and otherwise you orient yourself properly. Okay, unless and otherwise you orient yourself properly to this picture, many times there is high probability we can go wrong. Okay, there is a high probability we can go wrong. Okay, so this is about the various nerves in the cadaveric image and the interior of the cranium. Okay, I think this joints we have discussed yesterday. I don't want to wait this. We have discussed about all these joints yesterday, guys. We have discussed about the sutural joints, syndesmosis, gomphosis, everything we have discussed yesterday. Okay, I don't want to spend time in this. I hope you can easily do that. So next is an important area which is called as the triangles of the neck, which is called as an triangles of the neck. Okay, so instead of having this picture we will draw a simple diagram so that you can understand various landmarks in the diagram, thereby you can easily understand the triangles here. Okay, so if you see the lateral side of the head and neck region, so you get a protuberance here. So you get a protuberance here. So this protuberance or this bone is the occipital bone. So you get a protuberance here. This is called as an external occipital protuberance. This is called as an external occipital protuberance. From the external occipital protuberance you have a line running like this. This is called as a superior nuchal line. This line is called as a superior nuchal line. So you got external occipital protuberance. From there you get a line called a superior nuchal line. When you trace the occiput bone ends in a process. This process is called as a mastoid process. So this process is called as what? This is called as a mastoid process. This is called as a mastoid process. In front of the mastoid process you have the tympanic cavity. You have the external auditory meatus. You have the external auditory meatus in front of the mastoid process. Okay, so deep to the mastoid process you have a spike like projection which is called as the styloid, process. This is the external auditory meatus, EAM. External Affairs Minister Dr. Jayashankar like that, EAM, they call him as EAM. So here it is external auditory meatus. What you see here, medial to the external auditory meatus, more on the inner aspect you see a bony projections which is involved in the Eagle syndrome, that is called as styloid process. That is called as what? That is called as styloid process. In front of the styloid process, okay, you have the mandible bone, you have the mandible bone, you have the mandible bone. Okay, so these are the things. You have the mandible here, yes, you have the mandible. So these are the things you must know in this area. To understand the boundaries of the triangle, you must know this things here. Okay, and when you go below the mandible, okay, when you go below the mandible, you have another bone. Okay, this bone has got a greater cornua, a lesser cornua, and a body, and this is nothing but the hyoid bone. So what is this? This is hyoid bone. This is hyoid bone. What you see here, this is hyoid bone. Okay, and running below the hyoid bone, when you go below the hyoid bone, okay, you will see number of cartilages there. Okay, one is called as an thyroid cartilage, another one is called as an cricoid cartilage. We'll just add those cartilages here. So one is called as an thyroid cartilage, okay, that is seen below the, okay, so this is thyroid cartilage, and running below the thyroid cartilage is this cartilage which is called as an cricoid cartilage. So this is cricoid cartilage. So these are all certain cartilages and the bones you must know in this area, you must know in this area. Okay, and below, when you come below, okay, so you have the sternum. Okay, you have the sternum here, the manubrium sternum. Okay, you have the manubrium sternum here, and to the manubrium sternum you have the articulation of the clavicle bone. So you have the articulation of the clavicle bone here, you have the articulation of the clavicle bone here. And I hope you all know that there is a muscle called as sternocleidomastoid muscle. There is a muscle called as sternocleidomastoid muscle which arises from the clavicle and which arises from the manubrium. Okay, and it runs above. Okay, it runs above, they fuse with one another when they run above. So it has got two heads, one is the clavicular head, another one is the sternal head. They run above, okay, and they go and gets attached to, okay, and they go and get attached to the mastoid process. Okay, and they go and gets attached to the mastoid process. Okay, so I'll just change the direction a bit so that I can able to orient myself. So here is the mastoid process. So this muscle, okay, goes and gets attached to the mastoid process. So what is this muscle? Basically this muscle is called as the sternocleidomastoid muscle. The main function of sternocleidomastoid muscle, okay, the main function of the sternocleidomastoid muscle is to turn your neck to the opposite side. If you want to turn your neck to the opposite side like this, okay, so that action is produced by the sternocleidomastoid. Okay, when you see the posterior part of the neck region, okay, from the superior nuchal line, there is a muscle which takes its origin from the superior nuchal line and runs below and gets attached to the clavicle also. Okay, so the lateral end of the clavicle, receives the insertion of this muscle. This muscle which is present on the posterior aspect of the neck region is nothing but the trapezius muscle. So what is this muscle? This muscle is called as a trapezius muscle. So what you see here, this muscle is called as a sternocleidomastoid muscle, and this muscle what you appreciate here is called as a trapezius muscle. Okay, it's called as a trapezius muscle. Now from the scapular region, if you want to specifically say from the transverse scapular ligament, okay, so you have the scapula here, on the superior border of the scapula you have got a notch that is called as the suprascapular notch. So that is bridged by a ligament called as transverse scapular ligament. So from the transverse scapular ligament you have a muscle that comes here. So the muscle which comes from this area, okay, is called as the muscle which comes from this area is called as the homohyoid muscle. It has got two bellies. Okay, it is called as two bellies. So one belly is called as the inferior belly, another belly is called as an superior belly of homoid. They are joined by an intermediate tendon. So you got a muscle here which is called as an homohyoid muscle. So what is this muscle? So the muscle what you see here is called as an homohyoid hyoid muscle. This is called as an homohyoid muscle. Okay, in a very similar way, from the mastoid process, from the inner surface of the mastoid process, there is a muscle which arises, which has got again two bellies, that is called as the digastric muscle. It is called as a digastric muscle. Okay, that is called as digastric muscle. So this digastric muscle has got two bellies. One belly arises from the mastoid process, another belly arises from the digastric fossa from the mandible. Digastric fossa from the mandible. These two are again held by a loop. Okay, that is formed by the stylohyoid muscle. Okay, that is formed by the stylohyoid muscle. So you have an intermediate tendon here. You have an intermediate tendon binding these two muscles. So that is called as a digastric muscle. So that is called as a digastric muscle. Now if you see the neck, this is the midline of the neck. So this is the midline of the neck. Okay, this is the midline of the neck. Now the entire neck is divided into various triangles. The entire neck is divided into various triangles. Okay, so this triangle what you see here, okay, this triangle what you see here is called as an occipital triangle. This is called as an occipital triangle. This is called as an occipital triangle. So that is a part of posterior triangle. The larger part of the posterior triangle is called as an occipital triangle. Okay, the smaller part of the posterior triangle is called as an supraclavicular triangle. Is called as an supraclavicular triangle. Okay, so though the occipital triangle is big, only few important structures are there. Though the supraclavicular triangle is small, lot of important structures are seen in this. Okay, so what you see here is the occipital triangle, and what you see here, okay, is the supraclavicular triangle. And now you can tell the boundaries of the triangle easily. The occipital triangle is bounded anteriorly by the sternocleidomastoid. It is bounded posteriorly by the trapezius muscle. And it is bounded inferiorly by the homohyoid muscle. Okay, so this triangle what you get here is called as the occipital triangle. I am not going to write down these boundaries. I hope you can easily understand from the picture what are all the boundaries of the occipital triangle. Okay, done? Yes guys? Yes. Now it is visible. I think it is visible, guys. The screen is clear only. Yes, fine. So this is about the occipital triangle. So when you come to the supraclavicular triangle, the supraclavicular triangle is bounded anteriorly by the sternocleidomastoid. Okay, I'll just put it a different color. So it is bounded anteriorly by the sternocleidomastoid. It is bounded posteriorly by the inferior belly of the homohyoid, and it is bounded inferiorly by the clavicle. Okay, so this is about the supraclavicular triangle. And when you see this triangle, okay, which is bounded by the sternocleidomastoid posteriorly, and it is bounded antero-superiorly by the posterior belly of digastric, and antero-inferiorly by the superior belly of homohyoid, then that triangle is called as an carotid triangle. So this triangle is called as what? This is called as carotid triangle. So this is called as carotid triangle. Okay, this is called as carotid triangle. And the triangle what you see here, which is bounded by the sternocleidomastoid posteriorly, superior belly of homohyoid postero-superiorly, and by an imaginary midline in the center, is called as a muscular triangle. Is called as what? It is called as a muscular triangle. Okay, it is called as a muscular triangle. And the part of the triangle what you see here, which is bounded by the posterior belly of digastric, and by the anterior belly of digastric, and by the lower part of the mandible. Okay, and by the lower part of the mandible, this triangle is called as an submandibular triangle. Also called as an digastric triangle. This is also called as digastric triangle. This is also called as digastric triangle. This is also called as digastric triangle. Okay, and the triangle what you see here below the chin, this is called as a submental triangle. So this is called as a submental triangle. So this is called as a submental triangle. This is called as a submental triangle. So if you see the head and neck is divided into lot of triangles. Okay, so broadly the triangles of the neck are divided into posterior triangle, okay, posterior triangle and anterior triangle. Posterior triangle is further divided into, okay, posterior triangle is further divided into occipital triangle, okay, it is further divided into occipital triangle and supraclavicular triangle. And by supraclavicular triangle, it is supraclavicular triangle here. The anterior triangles are further divided into, okay, the anterior triangle are further divided into 4. One is called as a carotid triangle. Okay, next one is called as an muscular triangle. The next triangle what you see here is a digastric triangle. It's called as a digastric triangle. And the triangle what you see here is called as a submental triangle. This is called as a submental triangle. So you got carotid triangle, you got muscular triangle, you got a digastric triangle, and you got submental triangle in the anterior triangle of the neck. Okay, so if you see these triangles, lot of important structures runs in this. Lot of structures forms the floor of this. Okay, so I'll just enumerate only the floor. The entire triangles. Okay, if you take entire triangle, the roof is formed mainly by one structure. Okay, so if you take the entire triangle, the roof is formed mainly by one structure, that is investing layer of D fascia. Investing layer of D fascia forms the roof of all this. Skin superficial fascia and investing layer of D fascia is the one which forms the roof of all this. Apart from this, the main thing is about the contents. Okay, we'll come to the contents, but before that we'll finish the floor of the triangle. Okay, if you see the floor of the triangle, okay, so here you can see in the occipital region, okay, so there are several muscles running here. One is called as semispinalis capitis, this is called as splenius capitis, this is called as levator scapulae, and this muscle what you see is the scalenus posterior muscle. I'll just write the number here. It is 1, okay, it is 1, it is 2, it is 3, and it is 4. So these 4 muscle which forms the floor of the occipital triangle are here. So one is semispinalis capitis, the next one is called as splenius capitis, this is called as splenius capitis. The third one is called as levator scapulae, and the fourth one is called as the scalenus posterior muscle. It's called as the scalenus posterior muscle. These are the 4 muscles which forms the floor of the occipital triangle. These are the 4 muscles which forms the floor of the occipital triangle here. Okay, so these are the 4 muscles which forms the floor of the occipital triangle. And one important structure. Okay, so there are a lot of structures seen in the roof, like the cutaneous nerves. One important structure runs from the posterior to the runs from the anterior to the posterior aspect. This is an important nerve which is the content of this triangle, is called as an spinal accessory nerve. Okay, so this nerve is called as spinal accessory nerve. Okay, what is this nerve? So the content of the triangle, so we are seeing about the content of the triangle. So in the occipital triangle, the main content is the spinal accessory nerve. So the main content is the spinal accessory nerve. And can anybody tell me spinal accessory nerve supplies? What are the muscles which are supplied by the spinal accessory nerve? It supplies 2 important muscles. Yes, the two important muscles which are supplied by the spinal accessory nerve, one is trapezius, another one is sternocleidomastoid. Very good, guys. So spinal accessory nerve supplies trapezius and sternocleidomastoid. Trapezius and sternocleidomastoid. So we are seeing about the posterior triangle, we have seen about the occipital triangle. Now coming to the supraclavicular triangle here, coming to the supraclavicular triangle, the supraclavicular triangle, the floor of the supraclavicular triangle is formed by a muscle called as scalenus medius muscle, and the floor is also formed by a bone which is seen here. So the bone which you see here is the first rib, okay, the bone which you see here is the first rib, okay, and you also see a muscle arising from the first rib, that is the serratus anterior muscle, So these are the muscles which forms the floor of the supraclavicular triangle. So supraclavicular triangle is here. The supraclavicular triangle floor is formed by, okay, it is formed by the scalenus, okay, it is formed by the scalenus medius muscle, it is formed by the first rib, and it is also formed by the serratus anterior muscle, So this is about the floor of the supraclavicular triangle. Lot of important structures runs through the supraclavicular triangle, okay. So through the supraclavicular triangle, okay, so this is the triangle which they have wrongly marked here, okay. I'll just try to change it. This is called a supraclavicular triangle, and this supraclavicular triangle transmits the subclavian artery, it contains a subclavian artery, then it contains a subclavian vein, then it contains the trunks of the brachial plexus, it contains the trunks of the brachial plexus, okay, it also contains the dorsal scapular nerve, it also contains a nerve to serratus anterior, So subclavian artery, subclavian vein, trunks of brachial plexus are the important contents of the supraclavicular triangle, So this is about the posterior triangle of the neck. So we have done with the occipital triangle and the supraclavicular triangle. Next is an important triangle, that is the carotid triangle, When you see the carotid triangle, okay, so this carotid triangle has got various muscles which forms the floor, okay. So the muscle which forms the floor of the carotid triangle are two constrictors, okay. So you will see two constrictors here, so you can see a constrictor here and you can see a constrictor here, okay. So these two constrictors are, one is the inferior constrictor, another one is the middle constrictor, okay. Apart from these, you have got another two muscles forming the floor. So for the carotid triangle, the floor is formed by, okay, so the floor is formed by the superior, is formed by the middle, constrictor, then by the inferior constrictor, then by the thyroid muscle, and fourth muscle is by the hyoglossus muscle, So carotid triangle, the floor is formed by middle constrictor, it is formed by the inferior constrictor, it is formed by the thyroid and the hyoglossus, okay. These are the four muscles which forms the floor of the carotid triangle, and contents of the carotid triangle, lot of important contents are seen in the carotid triangle, okay. So the contents which are seen are the carotid sheath and its contents. So what are present in the carotid sheath? Yes guys, common carotid artery is present, internal jugular vein is present, and vagus nerve is present, within this. Vagus nerve is present within this. So all these contents you can see. You can also see the sympathetic chain running in the carotid triangle. You can also see the sympathetic chain running in the carotid triangle. You can also see, okay, you can also see the ansa cervicalis. You can also see the ansa cervicalis here. Okay, you can also see the several branches of common carotid artery. You can also see the branches of, okay, so you can also see the branches of external carotid artery running here. So branches of external carotid artery also runs in this triangle. Okay, so carotid triangle is very, very important. Common carotid artery is seen, internal jugular vein is seen, vagus nerve is seen. All these are enclosed in a sheath. This sheath is called as carotid sheath. This sheath is called as carotid sheath. You can see all those structures here. You can see all those structures here. You can see all those structures here. Okay, so you can see all those structures here. When you go okay, when you go proximally, okay, when you go proximally, you can also see the distal part of the parotid gland. Okay, you can also see the distal part of the parotid gland in this triangle. Okay, you can also see a part of the spinal accessory nerve, hypoglossal nerve running in this triangle. So this is a very, very important triangle. Okay, so this is an I just highlighted the important contents here. So with this we'll move to the next triangle of the neck region, that is the digastric triangle. So this digastric triangle is bounded by the two heads of the digastric muscle, by the two belly of the digastric muscle, and above by the mandible. Okay, so the floor of this digastric triangle, the floor of the digastric triangle is formed by the mylohyoid muscle. It is formed by the mylohyoid muscle. Okay, it is formed by the mylohyoid muscle. It is formed also by the hyoglossus muscle posterior. It is formed by the hyoglossus muscle posteriorly, and it is formed by the superior constrictor muscle posterior. It is formed by the superior constrictor muscle posterior. So superior constrictor muscle on the posterior most part forms the floor of the digastric triangle. Forms the floor of the digastric triangle. The important contents in the digastric triangle are okay, so one is called the submandibular gland. One is the submandibular gland. Okay, one is the submandibular gland, which is running here or which is seen here. Okay, you can also see the facial vein in this triangle. You can also see the facial vein. You can also see the facial artery in this triangle. You can also see the facial artery in this triangle. Okay, when you move more posteriorly, you can see the apex of the parotid gland. You can see the apex of the parotid gland. Okay, we can see the apex of the parotid gland. When you go slightly deeper, you can see the styloid apparatus. You can see the styloid apparatus in this triangle when you go more deeper. Okay, and in between these areas you can also see the internal carotid artery, okay, and the internal jugular vein in this region, and you will also see the 9th, 10th, 11th and 12th cranial nerve when you go much deeper in the digastric triangle. Okay, so digastric triangle, the posterior part is very, very important. Okay, when you go more deeper in this area, okay, when you go more deeper in this area, you can see all these structures. Okay, so one is called as an styloid apparatus, internal carotid artery, internal jugular vein, and the 9th, 10th and the 11th now you can see here. Okay, so this is these are the contents of the digastric triangle. These are all the contents of the digastric triangle. Okay, so when you see the other triangles, okay, these are all certain insignificant triangles, not of much bigger use. Okay, so submental triangle, what you see here, it contains the floor is formed by the mylohyoid muscle. The floor is formed by the mylohyoid muscle. Okay, nothing much big in the submental triangle except for submental lymph nodes. Okay, submental lymph nodes are seen in this triangle. Submental lymph nodes are seen in this triangle. Okay, submental lymph nodes are seen in this triangle, so nothing much to talk about in the submental triangle. And when you come to the muscular triangle, again the muscular triangle, nothing big structures. You have got lot of muscles here. Okay, you have got lot of muscles in this triangle. Deep to the muscles you have got the viscera like larynx and the esophagus. So this is not an important triangle. So muscular triangle, if you see, there is no big content, so only muscles you get, and the muscles you see in this muscular triangle are sternohyoid, okay, you see sternohyoid, you see sternothyroid, okay, you see sternothyroid in this, okay, and you see thyrohyoid in this, and you see thyrohyoid in this. So all these muscles are the muscles which you see in the muscular triangle, okay, all these muscles are the muscles which you see in the muscular triangle, okay. So this is about the triangles of the neck, okay. So this is about the triangles of the neck, okay. So see, it is very important. If you want to understand this triangle, okay, you have to sit by yourself, you have to draw the diagrams, and you have to analyze the boundaries and study. If I am telling you the boundaries, or if somebody teaches you the boundaries, at that time it might think that you understood these triangles, but unless and otherwise you sit and draw and study, these triangles won't come into your memory, okay. So when you have seen all these triangles, two triangles are very important. One is the carotid triangle, okay, where you see the carotid artery, common carotid artery, okay, and you see the internal jugular vein. And when you saw, or when you think about the carotid triangle, please remember the bifurcation of the carotid artery, okay, bifurcation of carotid artery, okay. Bifurcation of common carotid artery takes place at the level of C4, or at the upper border of thyroid cartilage, upper border of thyroid cartilage is the area where the common carotid artery divides into an internal carotid artery and an external carotid artery. It takes place at the upper border of the thyroid cartilage. And if you want to feel for the pulsation of the carotid artery, if you want to feel for the pulsation of the common carotid artery, you feel for it against, okay, so common carotid artery pulsation can be felt, okay, against a tubercle of C6 vertebra, that is called as Chesenak's tubercle, okay. So there is a tubercle which is called as Chesenak's tubercle, which is nothing but the anterior tubercle of the transverse process of C6. So you palpate the carotid artery against the Chesenak's tubercle to see the pulsations, okay. So this is about the important things about carotid triangle. Now what happens is in the neck, head and neck region, you got lot of lymph nodes here, okay, you got lot of lymph nodes. So many times when the patient suffers from diseases like tuberculosis, where the patient develops cervical lymphadenitis, these lymph nodes can enlarge, okay. If suppose a lymph node is enlarging in the posterior triangle of the neck, and you try to take a biopsy from that area, or if you try to incise the infected lymph node or an abscess in this, you can inadvertently cut this. Now you can cut this nerve, okay. The spinal accessory nerve could be cut. When the spinal accessory nerve is cut, trapezius won't work, sternocleidomastoid won't work. You will have difficulty in shrugging the shoulder, okay. So these are all the important things related to the triangles of the neck, okay. So I think reasonably we have covered the triangles. Maybe we may not have covered the triangles line by line, but these are the important things to be noted in the triangles, okay. Most important triangles are two. One is carotid triangle, another one is the digastric triangle, okay. So if you understand this triangle, okay, so please revise these triangles, and we will close the session by now. So Sunday evening, guys, you can take some rest, you can study whatever we have discussed in the last few days, and tomorrow morning we'll resume, okay. And when we resume, we'll try to cover the rest part of the head and neck, and we'll finish the other parts which is left bit, okay. We'll see you tomorrow. Thank you, guys. Thank you.